When choosing which Lasik procedure to undergo, it could be intimidating trying to understand all the types of Lasik procedures out there. This video aims to summarize the main types of Lasik surgeries and how they are performed. First, a quick overview of Lasik. Lasik is a process by which the cornea is reshaped using a laser. This is done either by cutting a flap in the outer layer of the cornea called the epithelium, or by completely removing the epithelium itself. Overall, there are 4 types of Lasik surgery: flap, no flap, touch, and no touch. Let's quickly run through the difference between flap and no flap surgery. The main thing to note for flap surgeries is that the flap never completely heals along the cut, and if the eye is impacted at just the right angle, the flap could open up again. But that is very rare and occurs in less than 1% of cases. The upside, however, is that the downtime for flap surgeries are way shorter than no flap surgeries, with some patients reportedly gaining perfect vision within 24 hours. For no flap surgery, it could take about 2 to 3 weeks before the patient gains perfect vision. Additionally, patients who undergo flap surgery may experience less pain during post-op recovery. This is because for flap surgery, you are only cutting a flap, while for no flap surgery, you are removing the epithelium. However, the epithelium would regrow fully in time. Thus, patients who undergo no flap surgery would not have any flap-related risks, unlike patients who undergo flap surgery. As for the difference between touch and no touch, touch means there is something touching the eye in order to perform the surgery, be it a blade or a circular tool called a trephine. No touch means only lasers are used to create the flap or ablate the epithelium with no need for any blades. Now, let us quickly run through the types of flap surgeries. There are 2 ways the flap is created. The first is by using a metal blade called a microkeratome that slices into the outer layer of the cornea called the epithelium, creating a flap. The flap is folded back, and an ultraviolet laser called an excimer laser is shot into the epithelium, ablating the stroma. The excimer laser corrects the vision according to wavefront topography mapping by machine. Once done, the flap is folded back. Alternatively, a thin plastic blade, thinner than a microkeratome, can also be used. These types of surgeries are called epi-Lasik. Epi-Lasik surgery is suitable for patients with thinner corneas as less of the epithelium is cut. Those are the ways that a flap could be created, using the touch method. The second way in which a flap is created is by using a no-touch method. Let us take a look at how this is done. First, a femtosecond laser is used to create a flap. Tiny plasma bubbles are formed beneath the surface of the cornea as the laser is shone into the eye. The flap is then folded back, and a second laser called an excimer laser is used to ablate the stroma. Once done, the flap is folded back. Some common types of these surgeries are LASIK and Relax Smile. For Relax Smile, a small difference is that the femtosecond laser first ablates the stroma through the epithelium, creating a disc-shaped piece of corneal tissue called the lenticule. Next, a small cut is made, so small that the flap cannot be folded back. A lenticule separator has to then be inserted into the flap in order to separate the lenticule from the stroma. The surgeon then removes the lenticule with a pair of tweezers. For Relax Smile, there is less chance of flap-based complications than normal flap procedures, and the downtime is shorter as well. However, one of the risks is that during surgery, the lenticule does not separate correctly. Now, let us take a look at no-flap surgeries. There are two types of no-flap surgeries. The first type is a touch method, commonly called ASA or PRK surgery. ASA stands for Advanced Surface Ablation, while PRK stands for Photoreflective Keratectomy. First, a circular tool called the trephine is pressed onto the eye. Alcohol solution is dripped onto the eye and left for about 40 seconds, allowing the alcohol to dissolve the epithelium. Once the outer epithelium is dissolved and removed, an excimer laser ablates the stroma and corrects the refractive error in the cornea. Once done, a protective contact lens is placed over the eye in order to allow the epithelium to grow back, and after about 1 week the patient can go back to the doctor to have the bandage contact lens removed. The second method of no-flap surgery is the no-touch method. This method is called trans-PRK, and the surgery is done entirely by laser. First, a femtosecond laser is used to completely ablate the epithelium. Next, an excimer laser is used to correct the thickness of the cornea. A bandage contact lens will be placed over the eye to allow the epithelium to regenerate. After about 3 to 5 days, the epithelium will have regenerated, and the bandage contact lens can be removed. The entire surgery is done using the same machine, for example, the Schwind Ameris, and little to no intervention by the surgeon is normally needed. The trans-PRK method is the newest, having only been launched in 2013. Some athletes in contact sports prefer this method, as there is no flap created during the surgery, and thus, no risk of cornea dislodgement. Overall, choosing the best LASIK surgery depends on what problem you are trying to solve, and many other factors. If you feel overwhelmed, you can try listing down the pros and cons of each surgery type or clinic and make a better comparison from there. About 600,000 go for LASIK surgery per year as of 2020, and for some, it turned out to be one of the best decisions of their lives. All the best for those who are still deciding.